Brain health and its challenges have been part of my and my family life for a very long time. And this is because both of my grandmothers, unfortunately, suffered from strokes. You may know that stroke is a medical condition where blood circulation in the brain gets impaired, leading to often irreversible damage to the brain. In the case of my maternal grandmother, the stroke was small, which is usually a good thing, but unfortunately this meant that the symptoms were subtle, so that myself, my family, my mother, who's an experienced nurse, couldn't pick up on the signals early enough. You see, we didn't have diagnostic tools or a monitoring device we could use to rely on. We were not sure what was happening to my grandmother. The diagnosis came late, and so the response, and unfortunately the extent of injury to my grandma's brain was greater, larger than necessary. Neurology is everyone's problem. The World Health Organization estimates that 1 in 3 people, on average, will develop at some point in their lives a neurological disease. 10 million people die every year of neurological diseases. This is equivalent of erasing a city of London from the world's map every year. When it comes to dementias, so conditions like Alzheimer's disease, more than 50 million people suffer from it today. And unfortunately, things are not getting any better because by the year 2050, we expect this number to raise to 150 million. So why do we struggle so much with neurology? Why can't we control these diseases the way we control heart disease or diabetes? Well, one answer is we don't really understand those conditions very well. And this is in turn because we lack tools to investigate people who suffer from those conditions, the patients. I'll give you an example. If you're suspected of suffering from, say, Parkinson's disease, you're likely to see your neurologist on average once every year, maybe once every half a year if you're lucky. And it doesn't really help that there's so few of them. As you can see, depending where you are in the world, there are between 10,000 and 40,000 neurology patients per single neurologist. And when they finally see you, they will likely have 15 minutes for you. They will ask you a few questions about how you're feeling, how you've been since the last visit. And they will likely ask you to walk up and down the room, and then they will look at you and subjectively, on a simple 4-point scale, they will decide whether your mobility is normal or impaired. Completely subjectively. There will be no measuring device or diagnostic tool they can use. This is far from optimal, and it's one of the main reasons why 1 in 4 diagnoses will be wrong, and why we diagnose those conditions very late in the course of the disease progression. So we miss on a vital window of opportunity to act earlier when the brain is still relatively healthy. Unfortunately, the same subjective methods and crude metrics are used in drug research. This is one of the main reasons why, despite decades of efforts now and billions of dollars spent by the drug industry, we still cannot cure, that is, we cannot stop or reverse the progression of Alzheimer's, Parkinson's, multiple sclerosis. Neurology clinical trials are exceedingly expensive and incredibly complex. And neurology sees one of the lowest success rates compared to all other therapy areas. We all know that brain is incredibly precious, but brain is pretty much a black box which we don't understand, and its complexity evades us. Brain health assessment needs a revolution. We need to change the ways we study the brain to have a chance to understand it. The answer may be on your wrist or in your pocket. Following the arrival of the internet and personal computers, more recently machine learning and artificial intelligence, mobile digital devices, your smartphones, smartwatches, smart pills, have become ubiquitous. They have become our constant companions. And whether we like it or not, and whether we're willing to admit it publicly or not, we spend hours interacting with these devices every day. Incredibly, and this may surprise some of you, these devices are packed with incredible advanced sensors. Think about Bluetooth, GPS, camera, LiDAR, accelerometer, some of them even more sophisticated or specialized, like oxygen saturation level sensor or body temperature sensor. What's important is that these sensors can answer clinically useful information, and they can answer questions your doctor wants to answer. Much of this information can be captured in the background without the user actually actively interacting with the device or the application. These devices open a new chapter in neurology, where digital, quantitative information can be captured by mobile devices, which are part of our daily lives, so that data can be captured frequently and at a large scale, and also in the real world, that is, as opposed to just at your doctor's office. And the data can be analyzed nearly in real time using machine learning, cloud computing, to produce deep and objective insights about our brain health. Think about this level of insight and compare it to a 15-minute interview with your doctor conducted once every year. Think about how different this conversation with your doctor would have been if they had access to all this information about you since the last visit, analyzed and organized for them to act on. This new paradigm for neurology has been put to the test. In 2019, 27,000 people ages 50 to 75, so definitely not your Gen Z generation, they were asked to use a smartphone app through which they played a game from time to time. And in this game, they explored virtual worlds. This app tested their memory and problem-solving skills. Data was analyzed with machine learning, and it was possible to use this data to distinguish between healthy people and those who were at a high risk of developing Alzheimer's disease. This is something that traditional memory tests used by clinicians at their offices cannot do. This is a clear example that these technologies can be used at a large scale and can answer questions which are novel and provide unique, unprecedented insight about our brains. Multiple sclerosis is a different kind of neurological disease. It affects much younger people in their 20s, in their 30s. People who have their whole lives still ahead of them. And the challenging aspect of this disease is that it affects different people very differently, in very unique ways. And those standard tests used at clinics, they rarely capture those individual differences. They rarely measure what truly matters to the individual. For example, their ability to walk, to use a laptop, to work. In 2018, over 100 people, most of them with multiple sclerosis, were asked to use a smartphone app, and also they were given a smartwatch. These devices captured their cognitive performance, cognitive information, and also their mobility data. Some of it captured in the background without their active participation. The data not only correlated with those traditional clinical metrics, but also offered an advantage. It correlated with the patient's subjective feeling about their psychological state. So it revealed the unique perspective, the unique story of each individual who participated in this initiative. Indeed, these devices can put patients like my grandma where they belong at the center. The data can reveal their personal journeys, personal stories, and measure what truly matters to them. They can also help patients engage with the disease and with the therapies and give them a vital sense of agency and a psychological boost, which patients who have chronic diseases very much need. For doctors, this is a chance to grasp a much fuller, much more complete picture of their patient's health. And because they have better information, they can make better clinical decisions. Also because they know more about their patients, they can build much stronger relationships with them. Researchers have been increasingly using these technologies in clinical trials, from just a handful of trials in 2010 to over 80 in recent years. Digital devices can help determine how individual new prospective medications act on patients in the real world and can determine unique differences of how these new prospective drugs affect different patients differently. This maximizes the chance of bringing new medications and producing new treatment options to patients. But as you can see, in the recent years, this positive trend has stagnated. So what may be stopping us from making further progress? Number one, performance. It is actually challenging to turn a consumer device, like a smartwatch, into a medical product or a scientific instrument, especially when it comes to the accuracy and reliability with which it captures crucial healthcare data. Number two, there are open and unanswered ethical questions about data privacy, transparency, and commercial use of healthcare information. We need to answer those biosecurity questions, as we've heard earlier today, before widespread use of these technologies is possible. And finally, access. You may not know, but around 20% of our society is considered digitally illiterate. This means that they struggle with finding, evaluating, communicating information online and using online tools and resources. If we leave these people behind, we risk creating a separate, a siloed digital healthcare system which is not serving everyone. So these challenges are undermining our trust in digital technologies. In response to this, a group of researchers from the UK have worked with a focus group of users to determine what measures can be taken to build trust in healthcare technologies. And from all the different factors represented here in with these bubbles, they investigated, they determined that the factors or the measures which were most trust building included the user's ability to customize and personalize the product to their needs, having it recommended by their clinician, having a clear access to a clear data privacy policy, and having full control of their data. So what are we learning from this, and what are the action points for all of us? For innovators, and I'm sure there are many of you here today in the audience, put patients at the center. Make sure they can customize and personalize the products you've created for them. And also communicate to them clearly and honestly, especially about how you're planning to use their data. Researchers, experiment. Include digital technologies in your research studies. These are low cost, low burden, and safe devices which can enrich your data sets. Help demonstrate value of these technologies for patients. Now to the Educators, it is time to include tech innovation in curricula of medical universities. Our doctors cannot fear technology. They have to embrace it and understand it so they can help patients adequately. Finally, us, the public. Well, when we consider how to best take care of our health, let's consider using a smartphone app or arrange a telehealth visit. We need to embrace digital technologies and get to know them. I hope I convinced you today that neurology needs a revolution and that this revolution may be within arm's reach. Most importantly, we can work together to realize this new vision and effectively rediscover our brains. So next time you speak with your doctor, ask them what digital solution they recommend for your brain health. Thank you.